Hello, my name is Fama. I'll be presenting on breast cancer today regarding Amara's case. Amara was diagnosed with stage 3 invasive ductal carcinoma after a self examination revealed nipple discharge and painless lump. IDC is the most common type of breast cancer, originating in the milk ducts and eventually spreading to surrounding breast tissues. In Amara's case, the cancer has progressed to the axillary lymph nodes and chest wall, indicating advanced local disease. Breast cancer cells typically grow and divide in a controlled way. However, this process is often disrupted by genetic mutations, such as the BRCA1 mutation. This mutation impairs the body's ability to repair damaged DNA, leading to uncontrolled cell proliferation and tumor formation. Over time, these tumors can spread through the lymphatic system to regional lymph nodes. Stage 3C breast cancer indicates extensive regional lymph node involvement and advances spread, which increases the complexity of treatment and risk of recurrence. Breast tissue consists of extensive lymphatic drainage pathways that allows the cancer cells to reach the axillary lymph nodes. As Amara had went through radical mastectomy with removing the axillary lymph nodes that can disrupt lymphatic circulation and increases the risk of lymphedema after surgery. The disease progresses as cancer cells spread into the axillary lymph nodes and chest wall. The stage 3C breast cancer signifies extensive regional lymph node involvement and advanced spread, increasing treatment complexity and recurrence risk. Amara faced numerous risk factors, but the most significant was her BRCA1 mutation, including her sex and age, also put her at a high risk of developing breast cancer. Pharmacological interventions. So, one of the key interventions for better treatment and the administration and ongoing assessment of the prescribed analgesia for her right sided modified radical mastectomy pain. She's experiencing pins and needles around her affected axillary area, which suggests neuropathic pain due to nerve irritation from the axillary lymph node removal. Effective pain management is crucial for improved comfort, mobility, recovery, and psychological well being. The nurse needs to regularly assess pain using an evidence based plan like a numeric rating scale. They should then prescribe medication appropriate for the pain, such as opioids for acute post surgery pain or non opioids like paracetamol for managing multimodal pain. Monitoring side effects like sedation, nausea, constipation, and respiratory depression is also important. Women undergoing mastectomy often experience acute and persistent post surgery pain, primarily neuropathic pain involving nerve pain. Effective pharmacological pain management can be beneficial in reducing pain and promoting a faster recovery. One of the non pharmacological interventions. Some interventions include positioning and arm exercise. Gentle positions and arm exercise help reduce discomfort and improve circulation and prevent further complications like lymphedema and shoulder stiffness. It's common for lymphatic drainage to occur after axillary lymph node removal, as this can increase swelling and discomfort. Regarding Amara, nurses should position the affected arm and support it with a pillow to encourage lymphatic drainage and reduce swelling. Gentle exercise should be encouraged to decrease stiffness and maintain shoulder mobility. It's also important to educate Amara to avoid heavy lifting and also explain that lymph node removal can increase the risk of lymphedema and further pain. Therefore, early mobilization and arm support are crucial for improving circulation and aiding a faster recovery after mastectomy. This is particularly important to follow as Amara's surgery involved lymph node removal and she has complained of sensation issues in the affected area. One of the first interventions in Amara's case involved ongoing assessment and wound management. After mastectomy, wound drains are commonly inserted to remove blood and serous fluid. This reduces fluid accumulation and promotes healing. Since Amara has two wound drains in place for a week or two post surgeries, monitoring is crucial to prevent complication and risk like infections. Nurses must regularly check wound dressings for leakage, bleeding, swelling, redness, odor, or increased warmth. Drains should be watched and documented, noting change of color and drainage amount. Perform proper dressing changes and drain care to prevent infection. Also, educating Amara to watch for infection signs and seek further guidance when needed. Ongoing assessment and management of surgical wounds and drains are crucial in this case. The excessive surgery of the axillary and chest wall is due to her stage 3C IDC, and the nature of the surgery involving tissues increases the risk of delayed healing. Effectively managing wounds and drains promotes faster healing and prevents further complications and improves patients' comfort. The second intervention involves monitoring and managing lymphedema and neuropathic symptoms. She's been experiencing pins and needles near her affected armpit, which suggests nerve irritation or damage post surgery. Additionally, she's prone to lymphatic drainage, increasing her risk of lymphedema and post operative neuropathic pain. Nurses should regularly check the affected arm and axillary area for swelling, heaviness, reduced mobility, pain, or skin tightness. They should also educate patients on exercise to prevent stiffness and further complications. Support the arm with the appropriate positioning to promote lymphatic drainage and avoid pressure on the limbs. This includes educating patients about early signs of lymphedema, skin care, and the importance of mobility. Additionally, nurses should assess nerve pain and administer prescribed medication. This intervention is crucial for Amara. She underwent surgery to remove her axillary lymph nodes and chest walls, which requires major surgery to remove her cancer. This surgery affects lymph fluid movement, and if it's not drained, it can lead to swelling and lymphedema, a common complication after breast cancer surgery. Therefore, checking for early symptoms helps prevent swelling and improves Amara's quality of life after mastectomy. As Amara prepares for discharge, she needs education to aid her healing and recovery and minimize complications. This includes her surgery, which involved removing axillary lymph nodes and surrounding breast tissue. Focus should be on the wound care, pain management, and preventing lymphedema. It's also crucial to educate her on wound care. She has two wound drains, which makes her susceptible to infections. Therefore, it is important to teach her about warning signs like redness, swelling, fever, smell, or any pain. She should also know how to change the dressings properly to prevent further infections and complications. Finally, she should monitor the wound. As mastectomy can lead to many infections post surgery, seeking help immediately is essential. Effective wound management supports faster healing and recovery. Following axillary lymph node removal, she is at increased risk of developing lymphedema due to altered lymphatic drainage. She should monitor any swelling, heaviness, tightness, or reduced mobility to her right arm to minimize infection and further pain. She should avoid heavy lifting or pressure on the arm. Simple arm exercises, increased movement of the affected arm helps prevent stiffness and prevent long-term complications. Education on pain management is crucial for correctly taking prescribed medication and using non-pharmacological techniques such as rest, support, positions, and simple movement to alleviate nerve irritation. After discharge, Amara needs various healthcare professionals to aid her recovery. A physiotherapist can help with her arm movements and reduce stiffness. Oncologists will assist with her ongoing cancer treatments such as chemotherapy. A social worker will also be ideal for financial assistance and childcare. Having support improves her recovery and overall well-being, making her feel better after surgery. This brings us to the end of my presentation. Thank you so much for listening.